Although coronavirus deaths continue to climb, experts say there are signs the death rates are falling in some places. The U.S. Centers for Disease Control and Prevention says death certificates show the percentage of deaths due to pneumonia, influenza, or COVID-19 was 6.6% in the week ending on September 19, down from nearly 10% the week before. In Britain, research showed a death rate of 1.5% in August compared to a rate of more than 6% during the pandemic's peak in April. Martin Landry, professor of medicine at Oxford University, says medical workers also know more about how to treat patients, including with the use of steroids called dexamethasone.
We now know that for those patients on ventilators, you can reduce mortality by a third with a simple, inexpensive, widely available treatment. We didn't know that, we do now. We also know that remdesivir reduces hospital stay, but we don't yet know still whether that actually improves survival. And keeping people out of hospital or reducing their stay in hospital is important, but it's not the key factor. The key factor is, can we save lives?
Landry is a lead investigator of Britain's National Clinical Trial Recovery, which is testing existing drugs in large-scale studies to determine their effectiveness.
Hydroxychloroquine, despite all its previous hype and advocacy and so on, does not work in patients in hospital. We know that lopinavir, ritonavir, so an HIV treatment, widely recommended, widely used, that also doesn't work.
As communities and universities decide on how best to protect against the virus, some experts suggest the COVID-19 is here to stay, just like other viruses. Professor David Heyman sits on the World Health Organization's Strategic and Technical Advisory Group for Infectious Hazards.
At present, it appears that it may become endemic. And if so, then we need to learn to live with this virus as we learn to live with HIV, as we've learned to live with other infectious diseases, most of which have come from the animal kingdom into humans at some time in the past.
Former U.S. Food and Drug Administration's Jesse Goodman is now chief scientist at Georgetown University.
We are going to have an ongoing challenge with COVID. The good news is we know ways to reduce the impact. We know now that social distancing can work. We know now that wearing masks can reduce both the risk to others and the risk to yourself. And we need really consistent public health messaging around this and engagement.
He says that will keep the economies going and avoid going in and out of lockdowns. Mariama Diallo, VOA News.